The only time I've ever yelled and screamed and absolutely embarrassed myself in retail was sitting inside of a community pharmacist. It goes back some time ago. Cos has heard this story before, and anyone I've met in the room has heard this story before too. But it goes back to days when my mother used to live with us and we were her primary carer, and she was on an inordinate amount of scripts. And we had this wonderful community, we had this wonderful pharmacist up the street who had been there for 30 years, and he was joyous. I mean, there's nothing was ever a problem. He sold that pharmacy to somebody, obviously, who proceeded then to renovate, to upgrade and to change. And we had believed that we would stay with him because he was in walking distance of our home. And in the past years, we'd only had extraordinary customer service and wisdom. I went in there one day, my mother was on multiple prescriptions. It was one of those dances that we used to do where the pharmacist was an incredible advisor, an incredible help, and between them and us, we managed to get what she needed to her. I went in this day and he had no idea who we were, which was fine because we were new, but this got really bad very quickly because in his move and in the change, he'd lost all the scripts. Couldn't find them, couldn't find us, couldn't care less. Totally told me to go back, get new scripts, which with my mother wasn't an easy thing to do because a lot of it required her to be at the GP to get those scripts. And we had a yelling match, which I'm not proud of to this day. That was 20-something years ago. I tell that story at the beginning of this conversation. My name is Misel. I'm a foresight strategist. I've had the pleasure of being at these conferences for the last 20 years, I think. It was about the first time that we talked about. And I've always talked about the notion of wisdom, of yes, you do incredible work, and not for a moment should it be undervalued. But to me, the greatest work that you do is the wisdom. It's the one-to-one contact with your customers and your patients that's so important. And that story's really underpinned all of my thinking around what a pharmacist might be into the future. Of course, doing all the extraordinary, exquisite work that you do, but wherever possible, getting in front of the counter. That relationship fractured. We never went back. We ended up finding another pharmacist who worked in exactly the same way we did in the past, and thankfully we went back on track. This conversation today that we're about to have is similar to that. Today we're going to talk about what I think is the elephant in the room for many people. It is the notion that 4 in 10 people in Australia have some form of disability. If you include chronic illness and carers, you're looking at 7 out of 10 people in Australia that fall into that basket of people. When you look at the pharmacy, that 7 out of 10 becomes closer to 8 or 9 out of 10 people walking into your doors. But yet I know firsthand, again, not because you can't and you don't, but it's not an often conversation that you have with somebody that is disabled about how better you can serve them, about what their needs are and what you might be able to do to help them in ways that you haven't been able to before. That conversation is a negative one. We're all in the same boat. Until we have that conversation, until we live through the eyes of people that have those lived experiences, it's difficult for us to know what to do. And this afternoon, our conversation is exactly that. We have 3 incredible panellists, who I'll introduce you to in just a moment, who are allowing us into their lives, allowing us to look at their interactions with pharmacists, to talk about the good and the bad, to take questions from you as well, and to be able to ask of them anything you might want to about how your pharmacy can change the way it runs policy, can invest in its people, can invest in its fit-outs. This is a safe room. All questions are open. And as you'll hear in just a couple of moments, we're going to hear some extraordinary comments about roles of pharmacy in people with disability, lived experience disabilities, lives. So without further ado, I'm going to introduce you to the 3 panellists. I'm going to speak to each of them, and then we're going to have a collective conversation between us about some of the landscapes into tomorrow of how pharmacists might work better with people with lived experience of disability. And I'm going to open it up to you for Q&A, to ask those questions of our panel. And that's our journey for the next little while. I want to thank all of you for choosing to be in this panel, to be in this conversation, and we'll start off with a conversation. So, firstly, Firstly, welcome, Julia.
Thank you.
So in the middle, we have the lovely Julia Rogan. She's a Senior Disability Advisor with Griffith University, Student Disability and Accessibility. After a life-changing accident 44 years ago, she's been left with chronic pain and some mobility issues, which have gotten worse over the years. She's now on opioids along with medication for Hashimoto's, depression and anxiety, and anti-inflammatories intermittently, and then Nexium to alleviate symptoms, mostly from inflammatories. Thank you firstly for joining us. So I want to ask...
Sounds a lot.
It does. It does. Anything left to say? So I want to start off by asking you a question. Specific challenges. And can you tell me about some of the specific challenges you encounter in pharmacies? You know, physical accessibility, communication, medication, management. What's life for you like when you go into a pharmacy?
I'm just looking around to see if my neighbourhood pharmacist is here before I say to it. Thank you for having me and your gracious words. So, just for a bit of context, my neighbourhood pharmacy and the one that is closest to my home and the one that would be the easiest for me to go to is the one that I try to avoid as much as I can. I have, as Morris was saying, several medications, but I found after 10 years, only one of the pharmacists even knew my name. And they obviously, what I would expect from the medications I'm on, that they would probably guess maybe I've got some pain issues, and but I have to stand in a long queue and wait and wait and wait. And so there's chairs you can sit in, but if you sit in the chairs, you get taken out of the queue because someone just moves up. So having to stand there, and they've changed their process over the last couple of years. I can remember the day when I would drop off my scripts and go and do some other shopping or go to the supermarket. But now they don't like you doing that. They like you to wait so that they can dispense straight away. So thinking, what? I might get 7 or 8 scripts. If somebody or a few people are in front of me getting 7 or 8 scripts, that's a long wait. And then, because they're a really busy pharmacy, often they'll ask one of the assistants to come and serve, and I get that, I understand, and they're learning, and that's great. But if I happen to go up to the counter and be served by one of them, I end up having to wait double the time, because while they can get the scripts, they then have to wait for a pharmacist who's serving someone else to sign off and check it's okay. So I think the accessibility and the wait times are the most frustrating and probably stop me from going back. And I didn't know, but so I'm on Targin as one of, and I didn't know till recently that I'm on an unusual dose. And the times that I've gone in, given that I've been on this particular dose for about 5 years, and they haven't got it. And there's, compared with a pharmacy I choose to go to more now, who makes sure she's ordered more for the next time I'm coming in. It's just really difficult. You all know that Targin's not something that you want to stop taking. So, but I'm left, and because I've got ADHD, yes, I go in at the last minute often, and I might need them the next morning because I've forgotten to organise it, and but they can't do it. And that's happened time and time again, not just once, that I can't get the script I need, not only on the day, but even by the next morning, because it depends on when the delivery people are coming.
What do you feel might be able to be done that would make your life easier in pharmacy?
Chairs that keep you in the queue would be one of the biggest things. I guess, and part of it, this might be something really personal to me, and I might be completely wrong, but sometimes I feel judged, especially if I might go in and want a certain cough mixture, which I know works really well for me, but you know, the reply is, well, you could have it, but you're on so many other drugs, you probably shouldn't have it. And when I ask why, well, if you overdose on it with your other drugs, you might get really sick. And these are medications I've been on for 10 to 15 years, 10 years with this pharmacist. And my GP's told me to go into the pharmacy and buy it over the counter, but I get questioned there about, do you really need this on top of all your other drugs? So it's not easy, and I guess part of that is because I know it's a franchise pharmacies, and so they don't have the same staff there all the time too. And while I know that's a business decision, but the pharmacy that I've been going to, which is not as convenient, and I can only, I'm only past there like 2 or 3 times a week. She knows my name. She knew my name after the first time I'd been there. And the big test for me was asking her for this cough medicine for my post-COVID cough. And she got it right down and said, that's a great idea. That'll, that might really help with your sleep, blah, blah, blah. She did say, have you talked to your doctor about it? But it was just much easier, much more comfortable. And it's, again, this is just, might be me, but it doesn't feel very discreet when I'm in there and, the assistant might be speaking to a pharmacist 2 counters over and saying, I need you to check off the endone or Prestige or whatever. So, I don't feel that it's very private, or I've never felt when I've got new medications, not that they've ever asked me in the whole time I've been there if I have had it before, but if I get an antibiotic or whatever, I don't feel like it's a safe place to ask how to use it.
So let's come back and explore that down the track as well, because that notion of safe place is a really important conversation to have. So we'll definitely come back to it. Thank you for that. I'd like to introduce you now to the equally wonderful Julia Robertson, accessibility consultant with Summer Foundation, Hopkins Centre Ambassador, co-facilitator Brisbane Brain Tumour Support Group. She's a consumer representative in research projects with New South Wales Health, Metro South Health, Brain Stakeholder Advisory Committee, and also with the University of Southern Denmark, Deakin University, University of Queensland and University of Sydney. That must take up a bit of your time.
A little bit.
A little bit. Well, thank you also for joining us on this panel this afternoon. Can I start by asking you to share some of your experiences of how pharmacies have or haven't supported you?
I've got some stories for both sides of that question.
Please.
On the not so happy side, I've had, similar to Julie, when I was first diagnosed with my brain tumour, I was on morphine, and a lot of morphine, and would have to go into the pharmacy and then argue with the pharmacist about what was written on the script. And because they then didn't believe what was written on the script, they'd phone the GP to double check, and this would happen every single time I took that script into the pharmacy. And I really got to the point where I just didn't want to take the drug anymore because it was such a hassle to get it from the pharmacy. You know, the script's there, it's been written, the GP's signed off on it, you're then calling the GP and they're signing off on it again verbally over the phone. Do I have to do this every single time I come into the pharmacy? On the other hand, the pharmacy that I'm with now, that I've been seeing for probably close to 20 years, they've saved my bacon on a number of occasions. There have been situations where my GP and a specialist weren't communicating very well, and I've ended up on a couple of drugs which were potentially fatal in combination, and the pharmacist has sort of grabbed me and gone, "Don't take that one, I'm calling your GP now. We'll sort this out," and then it's all been sorted out. Or medications that somebody's added or dropped a zero on a script. So coming home with 10 milligrams of epilepsy medication instead of 100 milligrams, and not really noticing because I normally get I usually get the generic, so they sometimes change their packaging. So it was a different package, and I didn't bother to check because it happens all the time. I get the drug, I take it home. It wasn't my normal pharmacy, it was a different pharmacy. By the time I hit the 3rd week of taking the wrong dose, I had a massive seizure. And then my GP wanted to know why I was only taking 10 milligrams because I hadn't noticed that it was the wrong dose. But I'd also had the same thing in reverse, where I'd gone home with 100 milligrams of something that was supposed to be 10, which wiped me out, and I've taken it and ended up unconscious on the floor. So it's those, there's been some really great experiences where I've had pharmacists who have literally saved my bacon, and on the other hand, I've been at really high risk situations because of my interactions with pharmacies.
In your work, you do a lot of work with support groups.
Yep.
Self-help support groups. Tell me what you think the role of pharmacists would be working with these self-help groups, or is there a role there?
I think there is a role there. I know that one of my biggest frustrations with some of the support groups is that because it's a brain tumour support group and people are desperate to live, they go and find anything off the internet that looks like it's going to cure their cancer. And we get a lot of really wacky things coming through, and I don't have any authority in that situation to say, look, don't do that. It's not going to work for you. It's not going to cure your brain cancer. But to have a pharmacist who could come in and say, okay, well, the side effects that you're having from these medications are normal or to be expected, or, you know, if you stick with this treatment regime, things will get better. But please let your doctors know if you're taking all of these other things that you've heard about on the internet, because the interactions between the drugs and the herbal remedies or the changes in diet can have such a huge impact on people's lives. It can be dangerous. So
there's a role for pharmacists beyond the 4 walls of the pharmacy.
Absolutely.
In advocating and in coming along and being involved, as they always have in the community.
Yep.
Thank you for that. So this panel, part of its reason for being is through Griffith University. About 5 years ago, we started up a department called, or a beacon as it's called, Griffith University, called Inclusive Futures, Reimagining Disability. And part of a new venture in that is something that we've recently put together called Inclusive Voices, which is the ability for corporates, individuals, manufacturers to be able to speak to some of our 500 plus growing community members, each of them with their own unique life experience and disability experiences, each of them trained, active and ready to speak their voice and to help people to understand the world from their viewpoint, from a first-hand lived experience. One of those people who are involved in Inclusive Voices is our next presenter, also wonderful, Dr. Chris Edwards,
Lovely.
Griffith University Adjunct Research Fellow. He's an autism researcher, I knew I was going to stumble over that, with Autism Spectrum Australia and an Adjunct Research Fellow at Griffith University. He's supported the autistic community for over 9 years through various educational and support roles. His research now covers autism in education, the community, mental health and adult experiences. Thank you for coming. So, Chris, can I start by asking you, can you discuss some of the unique needs of the autistic community when it comes to pharmacy services?
Yes, just checking I can be heard okay. Yep, cool. So, might just throw out some numbers. So in Australia, it's estimated about 1 in 30 or 1 in 40 Australians are autistic. And a significant majority of us experience co-occurring conditions like anxiety, depression, OCD, ADHD, and at least 70% of us take medication. Compared to non-autistic people, we face a higher prevalence of physical health conditions that affect nearly every major organ system. So we need support both for that mental health and physical health side of things. Like just myself, I think I had my gallbladder out last year. I take routine meds for anxiety, physical health. I'm in hospital every year or two for something different. We also experience a higher rate of premature mortality, both due to these diagnosed and undiagnosed health conditions. And in terms of your pharmacy, many autistic people are reluctant to disclose to healthcare professionals in general because of negative experiences, such as people not being believed or being infantilized or just being treated like crap, basically. So that isn't pharmacy specific. That's across all healthcare providers, and it's across all of society, really. And for every autistic person that visits your pharmacy that you know is autistic, there's likely many more that don't come to your pharmacy because of barriers, and there's also probably the ones that come and you're not aware of it because they haven't told you, they don't feel safe, or they're hiding who they are just to kind of get in and out and just survive. And part of that comes back to that people don't really understand what autism is. It's misunderstood as being linear from that low support needs to high support needs, but it's more of a constellation with different characteristics like communication, social interaction, leisure, sensory, thinking styles, emotional experiences, and that everybody, including pharmacists, need to understand autism in order to better support autistic people. Yeah.
Can I just add to that?
Please.
You did say we could. Chris was talking about people not knowing, but also over the last, I don't know, you guys will know better than me, but pharmacists or pharmacies have become a lot more diverse in what they sell. So often to get back to where you need to get medications, you go past some bright and sparkly makeup, some beautiful people wearing the makeup and selling the makeup or whatever, some really jazzy music playing, which is great, I guess, for the store to be noticed and to look great, but it's incredibly difficult. I know from many of my other students I work with, and as I mentioned earlier, I've got ADHD. It's incredibly difficult to manage, you know, with those lights and that noise, and then have to go up to wait on medications, and also if you're wanting some instructions to hear someone, but you don't want them to speak any louder because you don't want anyone else to hear what they're saying. So yeah, sorry, Chris, I was just wanting to add that that's become more and more of an issue.
Yeah, and I agree with that. I have that in my notes somewhere that I went to...
Sorry.
No, that's okay. I went to Chemist Warehouse, I think, last week with my partner just to get my meds, and I hadn't been to this one before, but there was just so much visual stimuli just all over the shelves, all the different colours, all the price tags. It wasn't just one price tag for the item, it was repeated just over and over and over, and it's just so much information that I left. I went and waited in the car while she got the meds for me. It was just too much, and if she wasn't there, then I don't know, maybe I would have gone to another store.
So following up on both of what you both said, what are some strategies pharmacies can implement to create a more inclusive environment for people with autism?
I've noted two things. So in the research, there's a framework called Autistic Space, and it's freely available if you just Google Autistic Space. It's a framework to make healthcare more inclusive and accessible. And it breaks down the 5, I guess, core autistic needs. So S, looking at sensory. So many of us experience these heightened sensory sensitivities that makes pharmacy environment difficult, like the sounds, the smells, those overwhelming visual stimuli. So pharmacies can make those practical adjustments to better accommodate these different sensory needs, like reducing the background noise or dimming bright lights or creating designated quiet areas. Attention should be given to minimising strong smells and just the whole texture. Like I know the downstairs I passed the quiet room for this conference, so something like that, a bit more private and quiet if you have to wait. P for predictability, so unpredictability or just that lack of structure creates anxiety, so need to look for ways to improve predictability in the pharmacy environment. Like scheduling appointments, minimising those wait times, those types of things. A for acceptance, so this comes back to that, I guess, safety, and that pharmacy staff need to understand autism so they can better support autistic people. And that really comes back to education and training to understand autism, that awareness, acceptance, so that autistic people can feel genuinely welcome and understood in the pharmacy. Because many of us have had those bad experiences with healthcare professionals, and I guess it really is on the pharmacy staff to show that you are a safe environment, that you're trusted people, that we know we can open up to you. Otherwise, it's more likely just to hide and just sort of get in and out. And then the other one I wanted to mention was the Hidden Disabilities Sunflower Program. So that's what this lanyard is part of. So it's a globally recognised initiative that allows people with a hidden disability to signal discreetly that they might require additional support. And I think it's something that pharmacies can adopt. So by participating in the program, pharmacies can demonstrate that they've been trained, they understand hidden disabilities, and that if somebody walks into the pharmacy with one of these lanyards on, it signals to whoever on the floor behind the counter that that person might need additional support, that person might need, I guess, something extra.
So, from your viewpoint, from all of your viewpoints, what training, what additional training would you like to see pharmacists have or go through or look at in order to better understand your worlds?
Who are you asking?
All. Whoever wants to tackle it.
I think, just from my point of view, often it's as simple as asking the question. I mean, I present well, but I have 2 brain injuries. I'm vision and hearing impaired, and I don't walk well. So asking the question, is there anything else that I can help you with? Or, it's really simple things like that that I think could make a real difference.
Can you
Will
repeat
Chris?
the question again?
Sure. So I'm asking, from your viewpoint, what additional training, understanding do you think pharmacists should do or have in order to make your experiences in store a more pleasurable and easier one for all of you?
I think definitely that education training for specifically around autism, but really broader hidden disabilities. They're called invisible disabilities for a reason. You probably can't spot them if you're just looking at the person. So it's something you need that more subtle awareness and understanding to truly better support that community.
And that's such a growing conversation now, this understanding of hidden disability. It's always been there. It's not as if it's new, but from a broader community perspective, it has been hidden. Unless we could see it, unless there was something physical about that person, it was really difficult for us to understand that notion that there was something that we can't see that was still impeding that perfect experience that we need to have. Because there's a question you want to ask.
Well, I was going to unpack, obviously today's an important session. When the Guild organised with Morris to put on today, we wanted to make sure, and we've got pharmacy groups that will be distributing this session too, because we want to improve. So if I unpack what Julie, Chris, first of all, thank you for your honesty. I mean, we can't improve as pharmacists until we get that feedback. But for our pharmacy groups who will be getting this video in particular, first of all, I just want to unpack that some issues are simple checks and procedures, issues that we learned as pharmacists. But in particular, some of the issues that Julie and Julia, pharmacists are so fixated with Schedule 8 drugs, the controlled drugs, the Targans and the endones, that they forget these are normal patients taking these medicines because we're fearful. If the count is wrong, we get in big trouble as pharmacists. So the first thing is I'm saying, for those presentations, half these issues would have been addressed if the pharmacists use the notes section of the dispensary software. So for our special guest today, you see your history, but I can make a note. And I might, if I'm not sure, I could run the first time and say, look, this person is on Targan, is that the right dose? But at least every other time the pharmacist comes in, you're not going to get that harassment that you were saying on each and every time. So for our pharmacists watching, and we've got both pharmacists and pharmacy executives here, the notes section of your dispensary software is critical. Secondly is that medication profile. Some of the areas you got are simple checks procedures. If the pharmacist is using a double bar scan, so most pharmacies, in fact in some states it's mandatory by law, I'll take a national approach to this conference, the pharmacist should be scanning the prescription and then scanning the label that they've done and double checking that by scanning the barcode on the box. So there's no chance, if the pharmacist is following that procedure, they should be doing a 10 milligram versus 100 milligram. And I think the issues that Chris was saying, they're especially, obviously I'm proud that I had 6 years on the board of Epilepsy Queensland, and every group has unique needs. But like Chris is saying with the identifier, in the same way, for example, over the last few months, pharmacists have made an extra effort to understand the needs of LGBTQ community in terms of how they want to be dealt with in the naming and nomenclature. But importantly, there's so many things we can do by my example on autism for pharmacists to understand. Unless you speak to the patient, ask all the questions. A manifest crash, you might understand this, Chris. One of my best customers had a massive rash, and that stress and anxiety would create a rash. And even after years, and I thought I always portrayed myself as a good farmer, I'd never asked him any other conditions. He was a male who came in, got low 0.5% cortisone, which you can buy without a prescription. But all along, if I'd done a full proper history, I would have worked out it was the anxiety from a precondition that we could have addressed, and that would have dealt with a prescription medication and addressed. So I think the lesson in particular, first of all, is each of those issues, for example, the waiting times that you were talking about, if you're at Queensland Transport and you're in a queue and you're in a mobile scooter, let alone a wheelchair, you get pulled out of this queue by guess who? The security guard. So pharmacies, because the waiting time, the other problem we've got, which I've identified, you may think it's a pharmacy assistant doing the scripts, but the intern pharmacist, when you graduate from pharmacy, you go 3 years or 4th year, it's probably an intern you've received. That script can't be released until, but if some people say, there's that person double checking because there's something wrong with my medicine, by the pharmacist wearing a simple badge like an intern badge, that would take away the stigma where you were worried about why am I waiting more than I should? And then some pharmacies, we're obviously very at Griffith, who's got a pharmacy school there. So we obviously it's mandatory for pharmacists to do the intern year, but I think your example was probably even an intern. It's actually a pharmacist who's graduated, but they can't get sign off until another pharmacist done there. So hopefully the lesson for today, Morris, is all these examples, the pharmacy should be analysing what are these issues that the patients, in this case, half the time the patients vote with their feet and they walk away. So the beauty of today is we're hearing real life cases from honest consumers telling us what the problem is, and the frustrating thing, Morris, is there's probably answers to most of these issues.
Thank you as always, Cos. So what we're talking about here really is the notion of all of us living vital, healthy lives to our own capacity in our own homes, in our own environment for as long as possible. And community pharmacists are so important in achieving that. In my case, as I said earlier with my mother, it was important that we had her medications and that everything was as it needed to be so that we could maintain her in a home environment. Otherwise it would have gone to the point of her having to go into care, which is something that none of us wanted. From your viewpoints, how important is community pharmacy in achieving that for people, giving them the ability to stay in their homes with a quality of life? And what other supports might pharmacists be able to offer to help that, to help maintain that possibility for as long as possible?
I had a conversation with an academic at Griffith not long ago who was a pharmacist, and he said that a long-standing problem with getting students to study pharmacy and people becoming pharmacists was that notion that they're on a bit of a conveyor belt where they type out the script, they pull out a box and they give it out, so it's not really a profession. And that made me think about the other aspect, and I'd forgotten, with the pharmacy I was going to, I had forgotten that pharmacists are more than that until I started going to my new pharmacy, and I think on about the third visit, as I was going, there was no one else around, and she said to me, "So how are you managing your pain? Are you okay?" Nobody at the pharmacy I had been going to for 8 or 10 years had ever asked how I was. And so I had even begun to think, well, they're just there to type out. And so a lot of it is easy processes, just to remember that it's a profession and they're there to support community people and people who are, even with Chris's numbers, getting lots and lots of scripts. But another interesting thing, and I don't know whether it's just a particular pharmacy brand, but something as simple as a process when pharmacists were started to be able to give the B12 injections, I think it was. Is that right? Has that been soon? So I've got really excited that for $15 I could get my B12 injections there. And so I asked one of the pharmacists one day, so how do I do, how can I do that to save going to the GP? And my GP was actually really in favour, and he was like, well, we need some sort of proof that you need it. And I said, okay, so what sort of proof? I don't know, but we need something. How do we know? And so in the end, his answer was, well, you need to go to your GP to get the blood results to show us and then get the injection. And I was like, so I have to pay to go to my GP to get the information, come back here and pay another $15. Why won't I get it when I'm at the GP? It wasn't going to help at all. And so it just seemed like some processes that hadn't been worked through. And I guess coming back to how pharmacists can be part of the community and how they can, some of the stuff is so simple, right? so simple of it just, you know, for a pharmacist to say that to me, go to your GP when you get your blood results, have an appointment, bring the results back so we can see. And didn't think there was anything wrong with that. And so why would and hence I haven't done that. Because I can get it when I go to the GP to get my blood results.
So I think the answer there for pharmacists watching online is, in some states like Queensland, the government has authorised pharmacists to administer all injectable medicines. That B12 is what we call unscheduled, so you don't need a prescription. So some pharmacists, as long as they had a system as a procedure, the answer to that is the pharmacy should have a system procedure to say, because we don't like initiating therapy, and because an injection is initiation of therapy, there'd be just a simple, once off, the doctor might write a prescription. So in our pharmacy, we'd be saying, well, I've seen that that Julie or Julia's, you know, got a prescription, and then they authorise, and then from a professional indemnity point of view, because pharmacists are worried about, am I going to do something if something goes wrong, at least then they record it, and the same in that history that I was telling you about earlier, because this is going to happen more and more. There's a lot of doctors now don't bulk bill, and I'm a Brisbane boy, and you can't even get a bulk billing doctor, and so many patients saying, for $15, that's more convenient for me to get at the pharmacy to make an appointment. So those injectable, that's going to be increasing now, because the government's basically moved from COVID vaccines and flu vaccines now to all the National Immunisation Program vaccines. But B12 is a very good example where, for my pharmacist colleagues watching online, it's important for them to just notate that in the patient history, use the one-off prescription for a doctor, and then make the note so that no matter which pharmacist is on, to do that, just a last point for our people watching, if a pharmacist is authorised to give flu vaccination, which thousands are, then they can administer a B12. If it's a Queensland, I'm giving you the Queensland example. If they've not been trained to give a flu vaccine, they can't do the B12.
No.
So you need to know as a consumer, when you go into your pharmacy, is the pharmacist is on right now, can they administer or can they not administer? And it might be a simple arrangement of an appointment time that you know you can get the jab on a Monday morning, Thursday morning, Friday morning. But that's a very good example to highlight, because the government is giving us more powers. Today, the health minister announced in Queensland that the pharmacists can initiate the oral contraceptive pill, but all this needs documentation, and pharmacists, simple request from a patient frustrated that you can't get it, and you were happy to pay. Most of the arguments with pharmacy consumers is, why am I paying $15? Because the pharmacists can't get MBS yet. You understand?
Yeah.
But that's a really good example, Morris, that we've given, where very simple, low-risk drug, the pharmacist could administer, and here we have a frustrated patient now who hasn't bothered even to try again because of a bad experience.
Thank you. Are there any questions in the room?
And I'll get the mic to you. One question at the back, please. Morris, give me a second, because I can't run any more this.
Of course, you're running microphones as well.
And then the second one here.
Great.
Thank you. It's extremely inspiring listening to all of you from a patient's sort of perspective. I really do feel that a number of pharmacists in this room, you know, would have the empathy towards your experiences. My question is around
could I ask
the
you to
education.
stand? Could I ask you to stand
Certainly,
up? It's just
absolutely.
easier for them to be able.
So my question is around the education for our pharmacists, and I think education in a number of ways. So from the universities to how they can teach upcoming pharmacists, their students who are going to become graduates and come into the workforce, and then perhaps education for pharmacists that are out there practicing. So from your perspective, who do you think are the best people to help us with the education that we might need to understand, from your perspective, you know, the care that you need?
Thank
I
you.
hope my question made sense. It's a little bit long-winded.
Sorry, your name is?
Maureen.
Thanks, Maureen. So Maureen's question is around education. If we are going to help pharmacists better understand people with lived experiences, how or who might administer that training best? Am I paraphrasing okay?
Yeah, that's good. I mean, for example, Morris, on the same we're talking about cultural training, we're doing understanding Indigenous issues. I mean, you work with Griffith University, you know, I guess the question is, are the pharmacy students there, the third-year students or first year of pharmacy, Is that a good time, perhaps, if we're asking our panel, is that a good time, or do you think it should be after they've graduated from uni?
Both. I think they should. I know in medicine now there's a special course they have to do and how to talk to people, how to communicate. I don't know if that happens in pharmacy, but I think it's really important. But because, you know, there's new conditions all coming up, or like neurodiversity, because of the amount of females particularly who have masks for years and now, like me, are getting diagnosed, and hallelujah. It's kind of ongoing, but I guess one of the ways would be through a speaker from Autism Queensland, or, you know, someone with a lived experience. We have a great beacon at Griffith who are looking at voices of people with disabilities. I think it's, or I hope everybody will agree that it's important to hear from people living with those things. Spinal Australia have people who will talk about chronic pain from, I mean, pharmacists know about that. They know how to put to scripts and prescribing and things like that, and drugs to alleviate what you get from taking the drugs to help you. But that human thing, I think, is important to be ongoing, the conversation.
Chris, Julie, anything to add?
Yes.
Excellent.
I had my thoughts, and it's coming and going. So the university part, so that, I guess, I'm only speaking from the autism side of things. So university-wise, a lot of the problem is there isn't, I guess I'm not familiar with pharmacy, but in healthcare in general, there isn't much autism-specific education and training at the university level. And of the training that exists, it's outdated, viewing autism from the medical model. So here's everything that's wrong with you type thing, rather than the social model of disability, or more looking at, you know, the ways the environment and people can support them better. So that's, fixing the university side of things is going to be quite difficult and slow. But in terms of the professionals out there right now, completely agree with everything that's just been said. You need to hear from lived experience people. So I work with Autism Spectrum Australia, where we're better than Autism Queensland, but
They are really much better.
it's based in New South Wales, but it's Australia-wide. But so we do workshops, webinars, all that type of stuff, and our workshops are like, it comes through the research team, and we make sure that an autistic person like oversees the content. So that's me as the only one in the research team, and then depending on the content, it's often co-delivered with an autistic person as well. And that's what you need. You don't need people, you need people with that lived experience to either to inform the training and deliver the training to you, because you need to hear from the people that you're trying to support. Okay, I got there in the end.
You did. And I'll put a plug in for Inclusive Futures, where that's exactly what we're doing. We have accessibility programs, we have people with lived experiences, so we're happy at any time to help people either in an induction program or on a one-off workshop basis, and eventually we're going to have an online course not too far away that people will be able to use and get micro-credentials for, that will take them through a whole range of accessibility and disability issues. I just want to add one more voice, if I can, with it, and this is putting a person on the spot, so she may not wish to, but Sarah is a senior lecturer at Griffith in this role. Are you able to answer the question of training and how people understand, or how future pharmacists?
I can't obviously talk about all the universities.
Sure, and I put you on the spot, so I apologise. But
I think it's definitely an area that we need to highlight and focus on. I know it's on our radar at Griffith, based on some work that I've been doing to explore accessibility. in community pharmacy, and I totally agree with incorporating the lived experience. We can't teach it without the lived experience. And we are lucky at Griffith to have the beacon. I think we need to strengthen that and talk to you, Elizabeth, about that. But I think it's a really important point that we're increasing our students' knowledge and understanding about a range of not just health conditions, but the importance of patient-centred care and understanding people's social circumstances and how we can better support them. But I think that comes down to that relationship building ultimately. It doesn't matter who you are. You need to have that relationship and just, to ask someone how they are. That's not a hard thing to do, and we can do that for everybody. So I think we do that, but that greater understanding of the range of people's experiences with disability, I think, could be focused on more.
So to Maureen's point, it doesn't appear that at the moment it is embedded into the curriculum, and it's something that we need to teach as well as. We can't assume that our pharmacy graduates are coming into our stores, into our premises, ready to have those conversations with people with lived experiences. Thank you for asking that. And there was another question there too.
Thank you for sharing your experience. It's wonderful to hear. Just so we can do better, I've got 2 questions, and if I could get each of your perspectives. The first one is, I hear about the safetiness. Like, I can hear that you want to feel safe when you come into the pharmacy.
Can I ask you just to put the microphone?
Oh, sorry. You want to feel safe when you come into the pharmacy, but obviously we've got the obligation to ask the questions about the cold interactions and, just all the questions that are required, just so we can get a bit of history. But I can hear that it's how we ask it, and also while we can use the private consult area, we may not be able to use it. So I think my question is, how do we ask in a way where it's less judgmental, more supportive? And I think even this question will help like neurotypicals, neurodivergent, and like anyone with disabilities, just that supportive questioning. How do we go about that? And the second question is...
So can I just do one question at a time, just to make it easy to answer? Sorry, your name again was?
Susan.
Susan. So Susan's first question really is about how do we effectively ask questions in pharmacy? How do we make sure that your needs are met and that your privacy issues are met as well? There are questions that have to be asked, obviously, and they need to be answered in order for that to move forward. How might that best be done? That kind of summarises that first question. We'll come to the second. I'm not putting it off, just one at a time though.
I guess, I understand it's a business, and I want to be really aware, while I'm sounding very negative, I've had some great pharmacists, and I know it's not an easy job, and there's, plans have to be made all the time to cover all sorts of things and make a living. However, so I did not know that, or never have known from the pharmacy I've been going to, that there was a note section that they could note anything, because I get asked the same things every time. But I wonder, and I know it's not always, as you said, you can't always use the room. I know the pharmacist has got one, but I wonder if you could say to a person perhaps who's a regular and on a number of medications, could you come in for like a 15-minute consultation, or do you want to? I mean, some people might not want to. I'm not sure really if I need that, but it would be good to know if at some stage, even 10 minutes, to see if there's any issues with the medications, or, is it a long-term thing? Have you had an injury is this just short-term, or is it going to be chronic? And whatever other questions you might want to know, I guess.
Any thoughts, Julia, Chris?
Yeah, please.
I agree with the being able to schedule, or the option to schedule appointments, because then that comes back to increasing that predictability and reducing the possible anxiety of entering somewhere new and not knowing what's going to happen. If I have a scheduled time, at least I can I can expect that it will be kind of followed roughly. And the other part about communication, so there are the communication differences between autistic and non-autistic people. So I guess some of those communication tips are more like using that clear language, using concise, providing information in multiple formats rather than just, I guess, talking at someone. Are there sort of handouts or written information? Are there accessible summaries you can give someone who might process written information better than talking? Because if you just talk at me, I might be taking in 10 to 20%, but if you give me something to read, I'll probably understand it a bit more. And it's really just, it comes back to empathy, just talking to them as a person, just, yeah.
For me, through COVID, because I am hearing impaired and rely on lip reading a lot, which is why I'm struggling a bit, my pharmacist understood that I needed to see his face in order to answer questions. So because of COVID and all of the things that we had to keep in place to keep everybody safe, we were actually writing the questions down on a piece of paper and passing it backwards and forwards, because I could read it. I couldn't hear the question, but I could read the question and I could verbally answer it, or I could write it down. So I think finding ways to ask questions quietly for people who can hear, or in a written format for people who can't. So just, again, asking the question, is it easier if I write this down, or would you prefer to have a conversation?
So before we go back to Sue, this is a clap for my pharmacy colleagues. We have a government-funded program called a Meds Check, where it's almost like pharmacist is remunerated, no cost to the patient, to do an audit effectively of your medicines. This is what you're on, you ceased this one. This is a classic example where the pharmacist is so busy they've not, the government's very strict on this program. You can only do 20 reviews a month. But you guys,
It's a lot.
I would deem you'd become my best friend if you're my customer, because you've got a lot of needs. So that's an example where the meds checks and the diabetes meds checks, there's a higher fee for that. But all three of you would benefit, and a good pharmacy would say, well, I'm going to do that review, so then share it with the team, write on the notes that a meds check occurred on this date in March 2024. But so there's practical solutions, and in this case, ones that the government is funding and happy to fund. So this is a classic case for our pharmacists watching, that a meds check and a diabetes meds check should be applied at some stage. Back to Susan for that second part, Morris, if that's all right.
Thank you.
And also, I think, we all understand how busy it can be. Like, the pharmacy I used to go to, and I don't know if it's normal, but I could be there 45 minutes to an hour to get my scripts, and it became a bit of a joke with my daughter, because I'd go to the supermarket as well, and she would text, and because I'd been gone so long, and she'd be like, are you picking up pills? Because I would just take so long. But I don't think anybody would mind if you said, look, this is a really busy time, but could we make another time to have a chat if you need to, or if you're willing? And is there a better way that we can cut down that time? Or can, if we, like for me, if I knew I could sit in one of the chairs that are there but still not miss my place in the queue, I'd be really happy. I would be happy scrolling on my phone and waiting for half an hour, because it's sometimes time on my own I'd be quite happy with, but not when I see people going through that I was in front of.
Thanks. And to your second question.
This is a rather broad question, but when I go back to the pharmacy on Monday, what's one thing that I could do to change how we can service and make things better for you? So I'd just like to hear from each and every one of you.
We're laughing because that was a question we were going to close on. And we're at that time anyway, so thank you for asking it. So the question is, when they all go back to their real world on Monday morning, they want to take one clear message. They want to take many clear messages, but one clear message from this conversation. What can they get their pharmacists to do that will make a difference in your life immediately?
I think make that human connection and ask the questions. That's a short answer.
And you know I'm going to say somewhere to sit and wait and not lose the cue. But apart from that, I guess, please know that we're just not that person who has multiple scripts a month. And I guess I was talking earlier about the safe space, but it also feels a little bit like taken for granted, because I'm always going to go back. Well, sorry, I'm really not going back anymore. I would rather drive further to a place I don't go to each day.
And Chris?
Can you consider implementing like the regular or sensory-friendly hours like supermarkets do? So every, Tuesday, 5 to 6 or whatever, the lights are a bit lower, the music's a bit quieter, those types of things. And it's not just enough to do it, but then you have to communicate it to people who could benefit from it. So is it on social media? Is it on your website? Are there other ways to reduce that anxiety and increase predictability? So does your pharmacy have pictures on the website? Are you showing, where we can park a car, what it looks like inside, what staff work there? So when we arrive, they're familiar faces to a degree. They're not just sort of strangers. What other ways can you increase that predictability? And it's, look, if you've got money to do the big changes, that's great, but it's often the little changes that other people don't really think about or don't really notice that can make the biggest impact for us.
It comes back to a word that I've used a lot over the years, that I've been lucky enough to have these conversations, and that's the sharing of wisdom. That really what we're hearing about here a lot is empathy and wisdom. It is doing what you do best, and you know how to do that. You know how to do that on toast. You can do it in your sleep. But really what this audience needs, and what most of your, if not all of your customers needs, is that wisdom from you. It's that one step further, even in the busy times, which we know is really every moment of every day in a pharmacy. But still, the reality is, if I put on my corporate hat, my corporate strategy hat, my foresight strategy hat, to Cos's point before, these are ongoing customers. They have a lot of money one way or another to spend, and they have to spend it in pharmacy. They have no choice. There is a choice which pharmacists they go to. And you've heard how often they will swap around, how often we all swapped around. Not that we were looking for anything cheaper. All we were looking for was a human contact, somebody that would listen to us, that would hear us and do what was required. That's the big difference between one pharmacy and another. That's why you're sitting in this room. I know that you've actively chosen to be here because you are that pharmacist. What we need you to do is to go out and spread the word further. I want to thank you for choosing to come to this session. I want to thank our panellists for being so open and honest with their conversations and allowing us even a glimpse into their world. So thank you very, very much for doing that. I know that it wasn't easy for any of you. Can I thank also, while I'm thanking Cos and the APP team for taking this on board and for allowing this to be a conversation at this year's conference. We really do mean that we are grateful and thankful that you allowed these voices to be heard at APP. So thank you to all your team for that. While I'm doing the thank yous, I have to thank our director at Griffith University, Inclusive Futures, Elizabeth, because she's the one that puts these conversations in front of people. She's the one that allows these types of conversations to happen, and she hates this. It's why I do it at every event. So thank you all very, very much for attending. Thank you for your interest. Please keep talking. If you are, this is the commercial plug. If you are interested, there is a brochure on Griffith Inclusive Futures and the programs that we run. If they're of help, please take one of these brochures and be in contact. But otherwise, continue to enjoy this most incredible conference. I wish you all the best. Looking forward to seeing what comes out of this and to seeing you all again down the track. Have a great afternoon. Thank you for attending.